Stop acute back pain. Brought to you by BackPainClinics.org. Please like our page and follow the signs for stop. So stop what is causing your pain, take painkillers, organise the next few days, and plan to start exercising. So if you're suffering from acute back pain, this is what STOP stands for. If you have any bowel or bladder problems, as in you're leaking or you're finding retention, you go straight to hospital. Current best advice for acute low back pain is to remain as active as tolerated. Although continuing to perform everyday activities may seem counterintuitive, activity keeps blood and nutrients flowing to the affected area, reducing muscular tension. A key to early rapid recovery seems to be good pain control and early movement, returning to activity as soon as possible. It's important you avoid the natural inclination to stay in bed or freeze to guard and avoid activity. Many individuals with acute low back pain find they can perform activities such as walking in spite of the pain and often feel better after. A common concern is a severe acute episode where people have spasms or acute locking, getting stuck in one position. Don't worry if this happens, the back muscles always unlock. The question is how to unlock them and get back to being able to do things quickly. Based on 30 years experience of treating patients with acute back pain, my advice is to take it easy for a few days and use STOP. It's important to identify what brought the pain on. Was it sudden? Most common phrase I've heard is, all I did was. If you can't think of anything, chances are there was something that brought it on. There's always something that brought it on. Think about what you've done recently or what you're not used to doing. Is it DIY tasks, cutting the grass, gardening, washing the car, change of a work position, perhaps even changing your car, lifting and carrying, be careful how you do this, or have you just started back exercising? Another consideration is what positions make the pain worse. Does lying on your back make it worse? If it does, try placing some pillows behind your knees. This helps take the pressure off the lower back. If lying on your side makes it worse, there's generally one good side and one not so good side. Lie on your good side and place a pillow or two pillows between your knees. If you lie face down, again, folded towels or pillows under your tummy should help. Be careful of your sitting position. Don't sit like this. Sit with your bum right in the back of the seat and some support in the small of your back, either a folded towel or a cushion. Standing position is equally important. Try and feel that you're standing tall and as though somebody is pulling you up by the ears. What movements make your pain worse? Is it getting out of bed, getting out of a chair, standing up straight or bending over? I will release a series of videos to help with these, so please enter your email address below the video to get access. And please don't forget to like the page. We now move on to the T of STOP, take painkillers. Please note I'm not a pharmacist nor am a doctor, so the advice I give here about painkillers is very general. Carefully read any instructions for any over-the-counter medicines. Pain control is important, and the over-the-counter preparations can be effective. A combination of paracetamol and ibuprofen is shown to be particularly effective for back pain. Just because you can buy it in the supermarket doesn't mean to say it doesn't work. It does work well. Paracetamol is a painkiller that works both centrally within the brain and at the peripheral pain source. 2 500mg tablets every 6 hours, combined with ibuprofen at a dose of 400mg 3 times a day is safe and effective for most people, apart from those suffering from asthma or stomach problems. Again, check with your pharmacist. My personal recommendation is to split your paracetamol and ibuprofen intake, so I suggest 2 500mg tablets every 6 hours of paracetamol, perhaps taken at 6 AM, 12 PM, 6 PM and 12 AM, and take your ibuprofen along with some toast or something, and take them at 9, 3 and 9. The split will give you good pain relief. It has also been shown that own-brand paracetamol and ibuprofen work just as effectively and are much cheaper. If you need stronger painkillers, you can add ones with codeine, such as Paracodol or Solpadeine Plus. These, with the addition of codeine, give you more pain relief. We now come to the O of stop, Organise. Organise time to ice regularly, especially if it's been an acute onset. Ice should be used for the first 48 hours, applied every couple of hours for maybe 10-15 minutes. You can then use heat after a couple of days, but ice in the initial stages is more beneficial. You may need to organise some time off work depending on the nature of your job, because obviously a manual job with lots of lifting and twisting is going to be more demanding on your back. But certainly I would suggest if you can't stand up straight or anywhere near the straight, then you've got a problem. Likewise, if you're shifted or moved off to one side like this, I would suggest you take a few days off. If you have pain down your leg, especially below the knee, or any tingling or numbness. Posture. Take care to build these elements into your everyday activities. So, be very careful. Make sure you sit well. Again, backside in the back of the seat with plenty of support, folded cushion or a pillow at the small of your back. Try and have your bottom quite high in the seat, so not in a soft chair. You have to look at your standing position. Again, look at your back, look at your head position. Look carefully at these pictures. They'll give you some good ideas as to how you should be, but just think of being pulled up by the ears, standing nice and tall. Again, driving position. Your lower back should be well supported with a pillow or a towel, and I would suggest you move your seat nearer the steering wheel than normal and have it higher than normal, so your hips are actually higher than your knees, unlike in this picture. And likewise, if you have to bend forward, not to lift because you shouldn't be lifting, but tie your shoelaces, put your shoes on, pick something off the floor, make sure that you bend from the knees and don't bend from the back. And the final part of stop is plan to exercise. And you're going to start with some gentle mobilising exercises. What you need to do is to like our page and then enter your email address in the box below this video, and we'll send you a programme of gentle exercises sent directly to your email box. Thank you for watching. Hope you found it useful. Again, please like and please share with anyone you think can benefit from this. And we'll be in touch soon.